much for meeting us today. I'm so excited to talk
It's
about
a pleasure.
this and for our viewers to learn, because this information has kind of transformed my mind. So starting with your the latest career path in chiropractic, which you still practice, you've now went into a bigger concentration in NAET therapy.
I eventually encountered NAET because a patient introduced it to me. And I read about it and I said, I have to investigate this. And it really is a very powerful hybrid use of acupuncture. Mm-hmm. It's not acupuncture. We're not using needles, although there are points where needles might be used, but most of the time it's not. And it made sense for me to do it. And so I concentrate mainly on using the NAET.
Most people now are familiar with acupuncture, chiropractic, and a lot of the things that you mentioned. This is totally different. So what could a person expect from their first treatment from you?
What they can expect is I'm going to want to get some health history. I want to know what happened to them. I want to look at their illnesses, hospitalizations, or other things they've done, what their reactions were to other forms of treatment. And the investigation we're going to do is going to include blood work. I may ask them to get a prescription from their doctor to draw blood to look for IgE or IgG antibodies. Mm-hmm. And I may also be doing some applied kinesiology, or we call it muscle testing, which people who are more comfortable with acupuncture may already have experienced.
So all of the things that you're able to test for are actually frequency-based.
Frequency.
And the body responds automatically.
Frequency is everything. And we've been using frequency medicine for decades and decades and centuries. Acupuncture, Ayurvedic medicine, homeopathic healing, many natural plant-based herb healing systems are based on frequency. And so the glass vials that we use are merely prepared using FM frequencies to replicate the item that we want to test somebody for. So we're careful when we're dealing with anaphylactic patients. We don't put the vials in their hands directly, but we are challenging the acupuncture system with frequencies. We can heal with frequencies, but we also want to, like when we're using essential oils and other products, but we also maybe want to prepare to ourselves to examine, well, am I sensitive to a frequency, an herb, a vitamin? Because we could be surprised to find out that frequency may be blocking an acupuncture channel, as well as providing the nutrition we need, right, but it could be causing interference. I'm looking to find out what weakens the acupuncture system. That's what's going to weaken or alter function in the body.
Right, so it's the weakening and these responses that are actually the stem of like major health concerns and diseases today.
Correct. And so NAET is a way of treating the whole acupuncture system and stopping it from reacting to specific groups and frequencies, such as all vitamin C products, all sugars, all minerals, just these by themselves. And that changes the stress on the acupuncture system, so that when the acupuncturist, naturopath, or other practitioners doing their traditional assessment, they're getting a much clearer view of what's happening inside. We're pushing ourselves so hard that we are becoming incompatible with what is truly life-sustaining and important for us to be having, whether it's eating, drinking, nutrients. And my job is to find out how that is. I'm not doing acupuncture, I'm not doing Ayurvedic healing, I'm not doing homeopathy. What we're doing, those of us who practice Nambujapad's allergy elimination technique, we're a little bit like the geek squad for the acupuncture system. Mm-hmm. We're editing it. We're not doing the traditional techniques. If this were the year 1919 or 1819, I wouldn't have a job. We frequently have problems today, and it's an outgrowth of our lifestyle today that we didn't have 100 years ago. Of course, we have chemicals in the environment, we have genetically modified foods, we're using fertilizers, but we're also getting by on 5 hours of sleep a night. We're overscheduled, overstimulated, and our lifestyle is as much to blame for our stress and these problems as chemicals, as some of these other endocrine blocking chemicals we're exposed to. So it's a big picture we want to look at. We can't answer everything, but it's important to recognize we have engineered our incompatibility to higher and higher levels now. So this type of form of healing is practiced by naturopaths, chiropractors, medical doctors, acupuncturists. We're all over. So people, when they're going to the national website, can find someone practicing it nearby, and they're going to have talents and skills and knowledge and history that I don't have. So there's a lot of personal insight that goes into each practice, and people are going to find a healing is possible when they investigate this.
Well, thank you so much. I think we covered it all. Is there any takeaways to think on?
Well, I think the takeaway is that the acupuncture system needs to be understood as being the anchor and the cornerstone for healing, whether it's acupuncture, Ayurvedic healing, it's the same system. Whether it's homeopathy or other forms of herbs. And ultimately, we are the caretaker for our own system.
I'll link all of his information below so you can check him out and read more about it.